This is the Mepilex Border Post-Op, a dressing designed specifically for surgical incisions. It has clear borders to allow skin inspection, a viral and bacterial-proof backing film, a highly flexible pad consisting of a retention layer to securely lock in what has been absorbed, a spreading layer, and finally the SafeTac adhesive. This is not the adhesive you would normally find on surgical dressings or tape. SafeTac is designed to gently mold to the contours of the skin and thereby minimize irritation or damage like blisters and maceration. In doing so, it also minimizes pain at removal. You will note that there is SafeTac adhesive across the whole contact surface of the dressing. This is how SafeTac protects the skin and incision. Exudate will pass through the small holes in the contact layer. The spreading layer then absorbs and transfers the exudate to the retention layer. The dressing allows you to see absorbed exudate right away, but the retention layer ensures that no fluid is sitting on top of the patient's skin. SafeTac is also hydrophobic and will therefore not stick to the incision, nor will it in any way disturb sutures, staples, or tape strips. When properly applied, it will provide Mepilex Border Post-Op with a 7-day wear time. Now, let me show you Flex technology. The flex cuts in the pad allow the dressing to stretch in all directions, making it conformable and comfortable, adapting to the patient's everyday movements, even if this is an extreme stretch that I'm showing you here. And remember, do not stretch when you apply. So, for the application, when you apply the dressing, it is very important to first ensure that the skin is clean and completely dry. Choose a dressing size with a pad that is about 1 inch or 2 centimeters longer than the incision. If you apply it to a knee, have the leg bent between 10 and 20 degrees. And again, remember to never stretch the dressing during application. Start by pulling about 1 inch or 2 centimeters of the middle release liner. Place the dressing on the skin, covering the incision. Then slowly pull the rest of the release liner about 1 inch or 2 centimeters at a time, pressing the pad down first. Use your thumb to support the dressing. You should try to minimize wrinkles and bubbles, much like when you apply a screen protector to your phone. This will ensure a shower-proof seal. Now, continue with the longer of the 2 remaining release liners. Again, about 1 inch or 2 centimeters at a time. Finally, you remove the smaller release liner and you are done. Always remember to smooth the dressing in place to secure a good adhesion across the whole dressing. A question we often get relates to allergies. Do not use Mepilex Border Post-Op on a patient that is sensitive to any of its components. It's also good to know that the dressing can stay in place during X-rays, CT scans, or ultrasound MRIs. Finally, when is it time to change the dressing? It really can handle a lot of exudate. Seeing exudate does not mean you have to change. Please change the dressing when the pad is about 80% saturated or when the exudate touches 3 of the 4 corners of the dressing, like this. So, to summarize, Mepilex Border Post-Op will be gentle to your patient's skin and wound. It will be flexible and comfortable, manage exudate well, be shower-proof, and provide a 7-day wear time. When you apply it, do make sure that the skin is clean and dry and don't stretch. Thank you. For more information, please reach out to your local Mölnlycke representative. and don't forget to give your patient a smile.